Hey everyone, welcome back to my channel. I'm Sheila G the PAC, and today we're going to get into a pretty common form of eczema known as dyshidrotic eczema, and this involves the formation of small, itchy blisters on the hands and the feet. Before we get in, of course, though, you know what to do. Don't forget to like, comment, and subscribe to my channel for all things dermatology. Let's get right in. Dyshidrotic eczema is a vesicular form of eczema where small, itchy blisters, known as vesicles, form on the palms of the hands, the soles of the feet, and the sides of the fingers and the toes. Another name for this condition is pomphalix, which in Greek translates to bubbles. Now, we don't know exactly why this form of eczema happens, but it's often associated with other types of eczema, such as atopic dermatitis or nummular dermatitis. There are some known triggers for the condition, such as excessive sweating, seasonal allergies, emotional stress, and exposure to certain metals, such as nickel. We also may see the condition worsen when there's frequent hand washing and exposure to other irritants, such as cleaners. Dyshidrotic eczema occurs in both men and women and typically develops in early adulthood. During flares, the small, tense vesicles form with clear fluid inside, and these are extremely itchy, often painful, and most commonly occur along the lateral aspects of the fingers and the toes. So these small blisters are often referred to as tapioca-like vesicles, and that's because they resemble tapioca pudding. Now, once these small blisters eventually rupture, the rash turns into these scaly plaques on the skin, and the feet and the hands can become extremely dry. They can fissure, and you can see cracks in the skin. Now, in more severe disease, we may even see nail changes, such as ridging, pitting of the nail, and thickening. Because the skin barrier is compromised due to long-standing irritation, cracking, and fissuring, the skin becomes more susceptible to bacterial and fungal infections. Now, fungal infections may be a little bit harder to detect because some of the signs of fungal infections, known as tinea infections, include itching and scaling, which is already part of dyshidrotic eczema. So if we suspect that there might be a fungal infection that's part of the eczema, we might do a skin scraping, or we might just go ahead and treat for a fungal infection with an antifungal topical treatment. Now let's go over treatment. So dyshidrotic eczema is most commonly treated with high-potency topical steroid ointments, and this is to combat any inflammation and hopefully restore the skin barrier. An alternative to steroids include topical calcineurin inhibitors such as tacrolimus or Protopic. Another medication is called Dupixent. Now, Dupixent is an injection biologic medication that's indicated for atopic dermatitis, but it has been shown to be very helpful in those with dyshidrotic eczema. During the vesicular phase, when the blisters are present on the skin, soaking and applying cool compresses can help dry those out. Whereas during the dry phase, after the blisters rupture and the skin is left dry, scaly, and irritated, it's important to incorporate creams or ointments that contain ceramides. And ceramides are proteins that help to restore and bring back moisture to the skin. Some really good brands that I like for hand eczema include Vanicream, Aveeno, Eucerin, Gold Bond, and O'Keeffe's Working Hands. Also, when washing the hands, you want to choose a hand soap that is fragrance-free and preferably contains moisturizing ceramides and oat for eczema relief. A couple of good products that I recommend include the Oatmeal Sensitive Natural Hand Soap by the brand Attitude and Zero Derm's Advanced Therapy Nourishing Hand Soap. For a lot of patients, especially those who can't realistically apply their treatment and lotions throughout the day, I recommend applying their treatment at nighttime under occlusion. An example of this is to apply a topical steroid and or a heavy moisturizer, and then apply a white cotton glove on top and keep that on overnight. By doing this, we're creating an occlusive environment where heat is generated, and the treatment can actually penetrate the skin a lot better. It can absorb and be a lot more effective. So there you have it, dyshidrotic eczema. There are so many different forms of hand dermatitis and different forms of eczema that I'll get to later on my channel. But for now, thank you guys so much for watching. I hope this was very informative. And don't forget to like, comment, and subscribe to my channel for all things dermatology. I'll see you in the next one.